India is facing a quiet but growing mental health crisis where access is limited, stigma remains deep rooted, and support often comes too late. In this evolving landscape, Rocket Health is emerging as a new age digital mental health care platform that is changing how Indians seek emotional well being. By bringing together therapy, psychiatry, cloud pharmacy, and AI driven tools under one ecosystem, Rocket Health is attempting to bridge long standing gaps in mental health care delivery. Founded in 2021 by Dr. Ritika Sinha and Abhineet Kumar and shaped by their early experience in a hospital in Bihar, Rocket Health began during the COVID 19 pandemic with free teleconsultation and has since scaled rapidly across Tier 1, Tier 2, and Tier 3 India. With the launch of Rocket Journal, an AI powered voice journaling app, the platform is now exploring how technology can support mental health without replacing human clinicians. I'm Dr. Anubha Jain, senior journalist with ETV Bharat, and today I will be in conversation with Abhineet Kumar, CEO and co founder of Rocket Health. Welcome to our channel, sir.
Thank you, Dr. Anubha. How have you been?
Sir, we like to know, can you briefly and quickly walk us through the story of Rocket Health and how your personal background shaped its mission to build a human-first mental health care in India?
Yeah, it's started by my sister and I, and we kickstarted this around COVID when, we wanted to help people with COVID. So it started as a volunteer effort. We did online teleconsults, using our network of doctors. And during that time, we saw a lot of people were struggling with, mental health care challenges. And that's when we started searching for brands out there which were solving for the mental health care problem in India. And there were very few, and henceforth we figured out that that's something we should go and build ourselves. So December 2021, both Ritik and I, we ended up kickstarting the journey of Rocket Health. We got our first few psychologists and psychiatrists, and from there on, people all across India have been able to take online therapy and online psychiatry through Rocket Health.
Okay, great. Perfect. Rocket Health is not the very first mental health platform in India, I would say. And there are
Mm.
similar initiatives like Trust Circle, Your Dost, with many international platforms like Talkspace, Better Help, etc. So, what are the key aspects that make Rocket Health distinctive from these other platforms? Or if I want to ask, what gap in India's mental health care ecosystem does AI-powered voice journaling address, especially for users who may not be ready for therapy?
Yeah, I think for the first part of your question, the brand matters a lot because you said, right, there's a lot of stigma around mental health care. And
Exactly.
when you have to appeal to, Gen Z and millennials and other generations as well, how you send out a message around mental health, the content you produce, the brand you're out there building, that matters a lot. So I feel like we're building a much more cooler healthcare brand which appeals to Gen Z and millennials a lot, where they feel they can be vulnerable and they can come down and talk to Rocket Health psychologists and psychiatrists at ease. So branding does play a big role. There are some amazing companies out there like the ones you mentioned. A lot of these companies are also marketplaces where they work with professionals on a part-time or a freelance basis, versus us, we end up like really bringing people on our payroll. So in essence, we're like a hospital on the internet. So that also allows us to give a better customer experience.
Right, right. And what gap, as I mentioned, in India's mental health ecosystem does AI-powered voice journaling address, especially for users who may not be ready for therapy?
Right. So what you're adhering to is like this app called Rocket Journal we launched recently, and it's basically an AI mental health companion. There are billions of people out there like globally, and probably a few 100 million Indians who want to access mental health care support, but they're not enough supply, right? There's not enough counseling psychologists and clinical psychologists out there. So human professional help is there, but not at that scale. And so we believe that, an AI mental health companion could easily be the first layer of support for people to like talk to. And these responses from that mental health companion are mostly CBT trained, more empathetic. So it gives you a safe space to open up. And once you get that safe space, it routes you to connect to a psychologist eventually if you need professional help. But before that, like the first layer of support and that safe space is extremely important. And it scales, which I think healthcare cannot scale to that many people immediately.
Right, right, right. So, how does Rocket Health define the responsible use of AI in mental health care, and where do you draw, clear boundaries between technology and clinical decision making?
Right. For us, it's pretty clear. Like, there are a lot of companies out there who would say they're building AI therapists, but you cannot really replace therapists. You cannot
Hmm.
really replace psychologists, right? You cannot replace human professional expertise and empathy. And for us, like, AI definitely plays a role if in the form of an AI mental health companion, for sure. That's good because if you can train your LLM in a more CBT backed manner, and if it's empathetic, it does allow you to vent and rant at like, random times when you can't access a psychologist. To that extent, it's great, but it'll never replace a human professional help, like a psychologist, the care and expertise they would bring to the table, that never like gets replaced. So it's very important to call out that distinction and market the AI mental health companion in an ethical manner to the consumer. You're not replacing therapy, you're basically building AI tools to enable more access to mental health care. So I think that's the important explicit call out which all companies should do, like whoever is trying to build like AI tools around healthcare.
Right, well said. So, how do you measure outcomes and success for AI-driven mental health tools like Rocket Journal beyond metrics?
No, I think a lot of like the work we do, whether it's at Rocket Health or like our product at Rocket Journal, we definitely try to collect as much user feedback as possible. So that allows us to see if like, the product we're building is, working in the right direction as well. Of course, like engagement and use of like a tool, if people continue using it, let's say if continue taking therapy, or in the case of Rocket Journal, if they continue using the app to sometimes come in journal and use the AI mental health, companion consistently, then that's a good sign, positive sign for us. Still very early days for our AI product, but I feel like that metric we are able to see, which is like continuous usage amongst people who download it. So I think like just looking at user behavior is where we pinpoint on.
So, do you see AI evolving from a support and reflection tool to a predictive mental health companion? And what ethical or clinical challenges stand in the way?
Yeah, I think when you feed like artificial intelligence tools your data and more about you, obviously they become intelligent and they show you insights about like a lot of things in your life. The other day, I had like a paper journal and I took a photo and I put it on Chat GPT and it analyzed it really well, like my behavioral patterns over like the first week of New Year, and it said, "Oh, looks like you want to start the new year on a good note," and it talked about like very important like points which I might have missed out otherwise. So definitely like certain insights which AI can give you on your data and your like story and narrative, that's pretty helpful. So to that degree, if people want to use AI to understand themselves, how do they respond in certain situations, those things are very very helpful, right? And like, but again, it's very important to understand the distinction that it's not replacing like talking to a healthcare professional. Like if you need help, you need to go to a psychologist or a psychiatrist. Like an AI tool is not going to provide you that care or help. It's not trained to do that. It's not replacing human care.
So, in continuation to this, my next question is again, as you mentioned about ChatGPT. So, with users increasingly turning to AI chatbots like ChatGPT for emotional support, so how is Rocket Health's approach fundamentally different, and why does clinical oversight matter?
Right. For us, see, we are building a healthcare company. So we have almost 100 psychologists and psychiatrists, all over India who provide therapy to people in India and across the world. So we are a very human-led company. Like we believe in building quality healthcare, which is human-led. At the same time, like in 2026, if we do not adopt AI tools, we won't be out there where the user is. So it's extremely important for a company like ours to balance, the healthcare quality and scale that, but at the same time build like small software and digital products leveraging AI that will allow like much more and larger scale of users to leverage our help. And so I think like for us it's balancing both, but definitely our core is obviously going to be like connecting psychologists to like users globally. That's going to be the core of what we do.
And then, any your closing note, closing remarks?
I would just say that this year, like we've started on a very strong note. I see a lot of people being vulnerable about mental health care, like on social media. Like I know COVID was a big like inflection point where people opened up a lot. I feel 2026, like especially with a lot of Gen Z coming into the workplace, they're also coming and taking a lot of help. They're also steering a lot of conversations around mental health. So I think we will end up like seeing a lot of momentum around the world of mental health. A lot of people will end up building digital tools and hopefully like quality healthcare like us, and hopefully we can like help out like many more Indians than before. So yeah, I mean that's all I want to say. Like I want people to just know that if you need support, you can always access. help from around you and from professionals, like Rocket Health and other places as well.
Right. Well said, sir. And thank you so much for your insightful thoughts. And as technology increasingly enters the most personal spaces of our lives, Rocket Health's approach raises a crucial question: can innovation and empathy truly coexist in healthcare? So, Abhineet Kumar believes they must, because in a country as diverse as India, the future of mental health will not be built by technology alone, but by putting human firmly at the center of it. Thank you so much, Mr. Kumar.
Thank you, Dr. Anubha. Have a lovely day.
Thank you.